my name is Tristan, and I'm going to be doing a trach suctioning and trach care video today. So the first thing that I would want to do is assess my patient for the need for suction and a trach care change, or a trach change. So I would assess like lung sounds, pulse, respirations, other vitals that would be pertinent to this. I would also assess the need for suctioning. I would assess like the type of secretions that the patient has, if they're like thick, just to kind of see, and like if they have a color to them or anything like that. So before we get started, we don't have actual like suction and oxygen on the wall. So what I would do is make sure that my suction is set at 80 to 120, and that my oxygen would be turned all the way up, because I want to make sure that I'm hyperoxygenating my patient before I like take away their oxygen and I'm doing their trach care. So I would want to identify the patient with two patient identifiers. I could use their armband. They may not be able to communicate very well. I could also use their MAR to compare the armband to a family member in the room. Have the patient nod if I repeated their name and date of birth or anything like that. I also want to make sure that my patient is in a high Fowler's position whenever we're doing this. And I also want to make sure that, since my patient can't communicate with me very well, sometimes when they have a trach, I want to make sure that I establish some kind of sign with my patient to where if I need to stop because they're uncomfortable, they'll raise a thumb at me or blink their eyes. So in this case, we're just going to have my patient put a thumbs up if I need to stop or give them a break or anything like that. So I've explained the procedure, I've provided privacy. The patient knows the reason that we're going to do this today. So I'm going to do some hand hygiene, and I'll put on a pair of just clean gloves. Go ahead and put this towel over my patient, just so we don't make a mess. Sometimes trachs can be a little bit messy. So I've made sure to turn my oxygen all the way up, so my patient is getting hyperoxygenation right now, and so that you just have a little bit more in their system before I take their oxygen off to suction them. So I'm gonna take off these gloves, gonna wash my hands, and I have my suction kit catheter ready. So I'm just going to open that away from me. And another thing I want to do, actually before I would open this, I wouldn't even open this yet. I've done hand hygiene. I'm gonna take off this gauze sponge underneath my patient's trach, just so that's out of the way because it's soiled. And then, okay, so now I'd get into my sterile suctioning kit. I would put on my sterile gloves. And get rid of that. So in here I have this little tray that I can put saline in. For this demonstration, I'm just going to simulate that I have some saline in there. That's just what you use to like clean out your suction catheter, so in between suctions if needed. So now I have, this is my suction tube. So I'm going to have one sterile hand and one non-sterile hand during this. So I have my suction catheter in my hand. I'm going to find, this will be my non-sterile hand now, so I'm going to get my extension tubing, or my oxygen tubing, connect it to my suction catheter, make sure it's nice and tight. So now I will take off the oxygen. And I want to make sure that whenever I'm going down, I'm not applying any type of suction, which means my thumb is up. I'm going in. Patient might start to cough at this time. And then when I'm coming out, I want to intermittently suction while turning my suction catheter so that I get all edges of the trach, and there's little holes on the side that will get all of that. So my patient is good to go with the suctioning, doesn't need any more. You can assess like lung sounds and make sure they sound clear. So then take this is my non-sterile hand, put the oxygen back over my patient's trach so that they're still starting to get some oxygen, and then we're done with the suctioning. So I can undo this and put this in my hand. Do that and toss it in the trash can. So then I would wash my hands. You can get rid of all of this smell. And so my hands are washed. The next thing we're gonna get ready to do is clean the inner cannula of the trach. So I have my sterile kit for doing that. I'm going to open it up. And right here I have this drape that has a 1-inch border of being non-sterile. And what this is good for is extending your sterile field so that you can move things in your sterile kit onto this sterile area and just give yourself some more room. So we'll move this over a little bit. We're going to put on our sterile gloves now. And we can get rid of that. So now I have all this stuff in my sterile kit that I can move on to this sterile drape. There are some things in here that I won't need, like these trach ties. We're not going to use that kind. So as far as in the kit for cleaning purposes, we have 2 of these peroxide things. We're just going to need 1, so I'll get rid of 1 for this demonstration. For the mannequins, we can't use the peroxide, so I'm just going to use the sterile water that's in the kit. But what I would do is I would do sterile water in each side, and then I would add the peroxide to one of the sides. So I would have just sterile water in one side, and then I would have sterile water mixed with hydrogen peroxide in the other side. But for this, we're just going to use the sterile water since we can't use the peroxide on the mannequins. Okay. So in this part of the trach here as well, I'll have 1 non-sterile hand and 1 sterile hand. So for I'm going to use my dominant hand as my non-sterile hand. So I've hyper-oxygenated the patient. So I want to take this part off. This is now my non-sterile hand. So I'm going to take out the trach cannula. And then what I'm going to do is I want to put it in the peroxide and sterile water solution first. And I'll just hang on to it with my non-sterile hand. This hand is sterile, so I can reach into my sterile field, get out my sterile brush, and clean the tube. And then I can go into this side. This is just the sterile water side. Kind of rinse it out. Then go over here and get like a pipe cleaner, whatever you get in your kit, and wash it out, get it a little bit dry so you don't put a wet one in there. Okay. So now we're going to put this back into the patient's trach. There we go. And put our oxygen back on just for a minute. Now I'm going to want to change the dressing that I took off underneath, put a new one on, and do some trach care, or some cleaning around the trach area. So I still have my sterile hand here. Use some normal saline or sterile water. Take that off again, and this is sterile. Just gonna kind of clean under the trach. And now that that's good, I can put this here. And at this point, whenever I'm changing the gauze and the trach ties, I don't need to be sterile anymore. So I can just take off these sterile gloves, wash my hands, put on a pair of clean gloves. So now I will have a package of these drain sponges on my table, and they are just the sponges, which there aren't any in here, so this is not sterile anymore because I'm not using it anymore. I'll just use these for the simulation. I will get it up underneath the trach, making sure that it's dry under there too before I put this on here, because we don't want to have any skin breakdown. That's one of the issues that you can have with trachs, is some significant skin breakdown if you leave any moisture in there. And then we can go ahead and put the oxygen back on while we do the trach ties. So this patient already has a Velcro trach tie on. We don't have any other ones for the simulation, so I'm just going to show you how I would replace it. So you may have to cut these because they may be a little bit too long for your patient. For instance, this one's a little bit too big for this mannequin. So what I would do is you would thread the trach tie through the hole on this cannula, and while you're making sure you're holding onto it. So this just kind of comes out, and then you can put a new one on, and you just thread it under there through the hole. Making sure you're keeping the trach intact, or in place. And you may need a partner, because sometimes this is a little bit difficult. Okay, and then you can just like adjust it to your patient's, and you would do the same on the other side, just making sure that there's, you know, room to move and it's not too tight and you're not causing any type of skin breakdown. So the patient's getting oxygen again, the trach ties are changed, they have a new dressing. The procedure went well. The patient didn't use the thumbs up, so they were comfortable. And then the last thing that I would do is I would need to document all of this to make sure that it's in the chart that we did trach care, we did suctioning, and that we're providing the correct care for our patient. And that is all.